Good morning, my name is Geraldine Thomas, and I'm going to talk about how interpersonal communication improves health. In our textbook, Interpersonal Communication, written by author Corey Floyd, copyright 2021, interpersonal communication is defined as communication that happens between two people, and that as it evolves, it allows them to define and negotiate their relationship. The content of this communication can vary widely from highly intimate to mundane or impersonal. And that is because each and every one of us have a wide range of relationships. So whether we speak to or communicate with our primary physician or our parents or a significant other, interpersonal communication is happening. Now, interpersonal communication is very important because it helps us to maintain and improve our health. Health being defined by the Merriam-Webster's Dictionary Online as the condition of being sound of body, mind, and spirit. At the beginning of chapter 1 on page 5, the author goes on to explain that how we use communication for our very survival. We use communication to meet physical needs. One of the most clear examples of the lack of communication and the effects that it has on physical health is seen in the punishment of solitary confinement. Being in an extended period of isolation will cause that person's health to deteriorate very quickly. The author also mentions that we use communication for our relational needs. We need to communicate for our needs for affection, fun, relaxation, to relieve stress, all of those things that we need for our mental health as well. We also use communication to form our very own identity and also to form our spiritual beliefs. So as we engage in interpersonal communication, we are meeting all of our needs for survival and to thrive as well. Scientific research has found a positive relationship between interpersonal communication and the improved health of an individual. In chapter 1, page 24, the author cites a few studies. One, for example, found that those who were married lived a longer, healthier, and more satisfying life than those who were single, widowed, or divorced. Another study researched the relationship between friendships and mental health and found that those with close friendships and supportive relationships were able to relieve stress. The last study found on page 25 showed that interpersonal communication does not have to happen face-to-face or in person to have a positive effect on health. Back in 2010, a research team followed about 35,000 different people from all around the world and observed how their interpersonal communication online was having a positive effect on their health. One group that particularly benefited from this was women, which, as we read in chapter 2, page 67, struggle with sadness and depression the most. So when interpersonal communication takes place between two people, a positive exchange happens. One that is not only helping us to survive as species, but also to grow, evolve, and to thrive. So whether we listen and follow our doctor's directions so we could stay healthy, or we engage in a business exchange so we can provide for ourselves and for our family, or we have a supportive relationship that lets us know that no matter what happens, we're going to be accepted and loved. Interpersonal communication keeps us going, builds us up mentally, physically, and spiritually.